Welcome to Northside 101, where Northside experts explain complex medical terms and procedures. Today's expert, Dr. Stephen Tugbiyele.
Hello, I'm Dr. Stephen Tugbiyele, urogynecologist here with Northside Hospital, and today we're going to be discussing an organ that women oftentimes ignore, and that's the bladder. And so without further ado, let's get started. In a woman, the bladder is very, very important. Function of the bladder is to hold the urine. The kidneys make the urine, it gets stored in the bladder. And so the bladder either is holding the urine, storing the urine, or it's actually helping empty the urine out of the body.
What are signs of an unhealthy bladder?
So signs of an unhealthy bladder. Women may have leakage of urine, meaning the accidental escape of urine when she either laughs, coughs, or sneezes, or she gets an urge and has to make it to the bathroom and doesn't make it there on time. Some women may have had surgery recently and they may have continuous flow of urine, and that can be an indication of either an injury that occurred during that surgery, something called a fistula, or women can have issues with what we call prolapse, meaning the organ of the bladder is dropped down into the vagina, which can then cause pressure, a vaginal bulge that can be seen or felt. Some women may have to lean forward or help reduce the bladder or manually lift the bladder in the vagina to help to empty. She may feel as if she hasn't completely emptied. Pressure, pain can accompany women who have a potential prolapse.
What causes a prolapse in a woman?
Vaginal childbirth is a major risk factor because that affects the pelvic floor, support structures, ligaments, connective tissue, and muscles. Aging is another one. Smoking is another one because of the chronic coughing and pressure on the pelvic floor. Obesity is another factor that can also lead to or increase the risk of prolapse. Risk factor that we find in women who have prolapse is excessive heavy lifting, repetitive excessive heavy lifting, as well as constipation. Again, because those activities put more pressure on the pelvic floor over time, that can increase the risk of women having prolapse.
What is incontinence?
Incontinence is accidental urine leakage, and it can occur as a result of many different things, either due to leakage with activities, laugh, cough, sneeze, jump, lift, exercise. Some women during intimate times, they leak urine, or it can be as a result of not making it to the bathroom on time, getting a sudden urge, and having to go frequently to the bathroom during the day or at night, and not making it to the bathroom on time, or as a result of some sort of abnormality in the anatomy to the pelvic floor, either due to surgery or some women are just born with that. It can be congenital, we say. Some of the risk factors for incontinence are aging. So as a woman gets older, the likelihood that she may have accidental urine leakage, it goes up. Women who've had vaginal childbirth definitely is a very significant risk factor compared to women who have only had cesarean sections. Women who smoke are at risk for incontinence as well because it accelerates the aging process. So those are one of the top reasons why women can have incontinence.
What can women do to lower their risk of incontinence and prolapse?
Well, one of the best ways is to maintain a healthy lifestyle, diet. We tell women to be mindful of things that can cause more urgency, such as coffee, teas, sodas, artificial sweeteners, carbonated beverages, highly acidic juices, sugary drinks. Those things can cause more urgency and cause more opportunities for accidental urine leakage. Maintaining an ideal body weight, avoiding constipation, and doing pelvic floor muscle exercises. We call these Kegel exercises. These are the muscles that support a woman's pelvic floor, or the muscles that a woman squeezes to stop the flow of urine or stop gas unwantedly. But women have to exercise those muscles outside of those particular activities, but do them several times a day. I like to say 100 kegels a day keeps the urogynecologist away. And that's a personal quote of mine that I've told patients over the years, just to remind them that the more kegels that she does, the better her pelvic floor support will be, and the less likely she will develop incontinence or prolapse in the future. So we tell women who have bladder issues to definitely take care of it early before it gets worse. As urogynecologists, we have training in both female urology and gynecology, so we are specially trained to definitely take care of this and manage this condition, specifically in women. Taking care of it early helps to prevent it from getting worse that may require more extensive evaluation and treatment. We offer things in the office, such as a pessary, which is a device that can be fitted inside the vagina to help provide support that can help women with incontinence or with prolapse. Because we are reconstructive pelvic floor surgeons, we offer our surgeries in a minimally invasive fashion, either through the vagina or robotically, laparoscopically, to avoid a major incision on the abdomen. And we are able to offer minimally invasive surgeries to the majority of women who choose surgery or who need surgery. So there are definitely options that we tell women that they don't have to live or put up with it, that they should seek help from us as urogynecologists. Again, this is Dr. Tugbiyele, and thank you for watching. please don't ignore your bladder. Until next time, be safe and be informed.